Benzocaine, also known as Anbesol Maximum Strength 20% Mucosal Gel, is used for short-term relief of pain from minor mouth problems such as toothaches, canker soes, sore gums or throat, and mouth or gum injuries. It is a local anesthetic that works by numbing the painful area. It is important to note that this product should not be used for children younger than 2 years old due to the risk of serious side effects. It is best to consult with your doctor for more details on the proper use of this medication. Make sure to carefully read and follow all the directions on the product package or as directed by your doctor if they have prescribed this medication for you. Do not use Anbesol, Benzocaine, Maximum Strength 20% Mucosal Gel more than 4 times a day unless directed by your doctor. It's important to allow the medication to stay on the painful area for at least 1 minute before spitting out or rinsing the mouth. Using large amounts of this medication or using it more often than directed can increase the risk of serious side effects, including rarely fatal methemoglobinemia. It's important to avoid getting this medication in the eyes. If your sore throat is severe or lasts for more than 2 days, or if your sore mouth symptoms last more than 7 days, or if you experience a fever, headache, rash, swelling, nausea, or vomiting, stop using the medication and tell your doctor. These symptoms may indicate a serious medical problem that requires different treatment. If your condition lasts or worsens, or if you think you may have a serious medical problem, seek medical help right away. Some people may experience a slight burning, tingling, or stinging sensation when using Anbesol, Benzocaine, Maximum Strength 20% Mucosal Gel. If these effects persist or worsen, it's important to speak with your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. It's important to be aware that in rare cases, this medication can lead to a very serious blood disorder called methemoglobinemia, which can be potentially fatal. This is more likely to occur in individuals with breathing problems, certain blood diseases, or those who smoke. Symptoms of methemoglobinemia can appear shortly after using the medication, and may include pale or bluish skin, unusual fatigue, shortness of breath, rapid heartbeat, dizziness, headache, or confusion. If you experience any of these symptoms, it's crucial to stop using the medication and seek medical help immediately. While it is rare, a serious allergic reaction to this drug can occur. If you notice any symptoms such as rash, swelling, severe dizziness, or difficulty breathing, seek medical assistance right away. This is not a complete list of potential side effects, so it's important to speak with your doctor or pharmacist if you notice any other effects. It's important to note that in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Anbesol, Benzocaine, Maximum Strength 20% Mucosal Gel, it's important to talk to your doctor or pharmacist if you have any allergies to benzocaine or other cane anesthetics, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. If you have certain health problems such as heart disease, certain blood disorders, or breathing problems, it's important to consult your doctor or pharmacist before using this product. It's also important to inform your doctor or dentist about all the products you use before having surgery. If you are pregnant, this product should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It's also uncertain whether this product passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Anbesol, Benzocaine, Maximum Strength 20% Mucosal Gel, it's important to follow the recommended dosage and use it as needed for pain relief. This product can be used for temporary relief of pain caused by minor irritations or injuries in the mouth and gums. It's best to use it at the first sign of pain for the best results. When using Anbesol, Benzocaine, Maximum Strength 20% Mucosal Gel, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. To ensure safety, it's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with a healthcare professional before making any changes to your medication routine. If you or someone else has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, seizures, and irregular heartbeat. If you're concerned about an overdose, don't hesitate to seek help right away. Make sure to attend all scheduled medical appointments and laboratory tests while using Anbesol, Benzocaine, Maximum Strength 20% Mucosal Gel. It is important to follow your doctor's instructions and keep track of your progress during treatment. This will help ensure that the medication is working effectively and that any potential side effects are promptly addressed. Anbesol, Benzocaine, Maximum Strength 20% Mucosal Gel is used to relieve pain and itching caused by minor skin irritations, sore throat, sunburn, teething pain, vaginal or rectal irritation, ingrown toenail, hemorrhoids, and many other sources of minor pain on a surface of the body. It is also used to relieve pain and itching from minor mouth problems such as cold sores, canker sores, and sore gums. This product contains benzocaine, a local anesthetic that works by numbing the painful or itchy area. When storing Anbesol, Benzocaine, Maximum Strength 20% Mucosal Gel, make sure to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. It's important not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product expires or is no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. As for the best time to take Anbesol, Benzocaine, Maximum Strength 20% Mucosal Gel, it is recommended to use it as directed by your healthcare provider. Be sure to follow the dosage instructions on the packaging or as advised by your doctor. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.